He's an expert in clinical epidemiology and biostatistics at the University of Newcastle. Would you be prepared to live in the Upper Hunter?
Well, that's an interesting question. I mean, I certainly wouldn't be prepared to raise a family or to personally live in a place that's exposed to this much pollution.
Associate Professor Higginbotham has researched the impact of large-scale mining development on the environment and people's health.
In my opinion, the air in the Upper Hunter Valley is not very good at all. There's also quite a bit of pollution that comes out of the two power stations in the Upper Hunter. And the combined effects of the dust produced by mining processes and transport of coal and the two power stations has caused, over the last, say, 10 or 15 years, quite a bit of distress among residents of the Upper Hunter who are concerned whether being exposed to this much pollution has some kind of an impact on their health. The 2.5s can find their way even further into the lungs, and they're even more damaging to the health because they can get into the bloodstream. And there's a large, well, there's a range of diseases and illnesses that accrue from this kind of particulate penetration of the lung system.
The international scientific evidence on the health effects of coal mining is mounting. A report this year on open-cut coal mining in the United States found elevated rates of mortality, lung cancer, and chronic heart, lung, and kidney disease among people living near coal mines.
Well, we know that for every 10 micrograms increase in the concentration of dust, we get a 0.5% increase in the mortality rate. Now, there's been a lot of research overseas which has looked at particulate matters and a whole range of issues such as cardiovascular disease, pulmonary disease, asthma, respiratory issues. So there is a substantial and healthy literature which allows us to draw very strong conclusions about increasing the amount of dust in the atmosphere and the increase in disease and death.
How'd you go, Alex?
The preliminary results of Dr. Rao's work with Singleton school children bear out these studies.
I think it's probably reached a peak now because there is so much expansion of mining industry.
Recently, her uncle's dairy farm was bought out by the mines. She's well aware of the pain mining can inflict. What do you say to people who say, look, if you're too close to the mine, you should just pack up and move on?
Okay. I knew you'd ask that. I'm a fourth-generation Singletonian. Sense of place. Sense of place is important to me. Not easy just to go.
So being able to be in Singleton, to see the place the way it is, to see the mountains, to see the valley the way it is important to you. Just 15 kilometres to the east of Singleton, Dr. John Drynan, a retired agricultural scientist, now runs a beef cattle farm. Along with dozens of other locals, he became concerned about what appeared to be increasing levels of ill health in the community. Like any good scientist, he set about gathering the evidence in a methodical way. He held a public meeting and put out a questionnaire.
First of all, a survey that we did that was put into chemist shops and schools and places like that showed that around about 350 people responded. They all confirmed what we'd heard at the public meeting. We believe our health is being adversely affected by what we're breathing.
And these are things like asthma?
Asthma, other sinusitis, other respiratory problems and allergies, and eye problems, cancers and so on.
In the time we spent in the Upper Hunter Valley, bronchial problems were by far the greatest concerns expressed to us. But another medical condition also repeatedly came up: cancer.
Now we got to see Peter. He had a brain tumour about 2 years ago.
What's so comforting for many of the cancer patients that Dr. Al visits is the community support that many of them receive.
Hello, Peter. How are you?
Good. How you going?
And Narelle, how are you? How are you?
The friends and neighbours are there for them to help out.
Whatever happens, mate.
Peter and his wife Narelle have just been to the hospital
That's all right.
in
Yeah,
Sydney.
mate. So, yeah.
The news isn't good. The tumour's back, and this time it's inoperable.
So the chemo's not working, the surgery's not working.
We hear a lot of different stories of people having cancers and cancer problems in this area. Do you also hear those stories?
We know quite a few. The house next door, there'd been 2 people that had lived there over the years. One had bowel cancer. We don't know if he's still alive. They moved away from the area. And an elderly woman, she got throat cancer and she passed away. There's been a few up the road. Recently there was another man who he was diagnosed a week after Peter, and he only survived 6 months. One of our old neighbours, Carol, across the road, she had a benign tumour, and Peter across the road, he had a benign tumour 30 years ago.
The government's reaping, millions from royalties. The coal mines are making billions from the coal, but the least they can do is just try and find out whether any of it's causing any health problems, and everyone will be happy.
Yeah, this is the old girl. The old girl here.
Oh, it's fantastic.
Yeah, a lot of work. I enjoyed it.
Yeah. Peter McMahon spent years restoring his treasured Buick.
So that's it. Yeah.
How does it feel?
Oh, mate, it's good to drive. It's bloody. It's lovely.
Do you think you get a chance?
Well,
To drive it again?
Well, I hope so. But what the chance is, I don't think so. But I'd like to. Yeah. So.
Peter will hit the road tomorrow, but not in this car, travelling to Sydney for another round of treatment. We asked the New South Wales Minister for Health and Deputy Premier Carmel Tebbit for an on-camera interview to answer the questions raised in this programme. She declined. In a written response, the Minister rejected the call for an independent health study, saying it would, and I quote, not be conclusive due to the relatively small population of the Upper Hunter Valley. It's a novel argument which may not go down too well with the 40,213 people who live there. Dr. Tuan Au is most concerned about Courtney, who's on a cocktail of drugs to help control her condition.
How often does he have to use a Ventolin?
She's on the Ventolin every day, morning and afternoon. And she also has, she has a Seretide every morning, and then the Ventolin, and then she has her Seretide and her Ventolin of an afternoon, before she goes to bed.
Last year, she lost 3 months off school because of asthma. It disappeared while she was on holiday on the coast, but returned when she came back home.
She was good.
Is it good?
Yeah, yep, no, she had no trouble. She even said that she had felt a lot better within herself.
The G family have every reason to fear for their children's health. Just 6 weeks ago, a huge orange cloud came sweeping up the valley over their dairy farm. It left a light dust on the ground, and 2 of their children fighting for breath.
This is environmental injustice. It's a very stark case where economic incentives, political incentives, are disadvantaging the citizens of a region. I mean, some would say, and we would agree, that there's a sacrifice going on, that these townships, these communities are sacrificed to the greater good of economic benefit for the state of New South Wales and for the companies that make their profits.